Welcome to Capitol Preview, a weekly bipartisan discussion with Iowa legislators about the key issues facing our state. Brought to you by Mediacom.
Welcome to another episode of Capitol Preview, a show where Mediacom and the Iowa Cable and Telecommunications Association bring you representatives and senators from Iowa to discuss deals that are happening up at the Capitol. Our guest this morning is Representative John Forbes, District 40 Democrat from Urbandale. And we welcome you to the show this morning, John.
Thanks for having me on again, Bill.
Yeah. You know what, you know how this format goes. It's just kind of a conversational type of thing. We'll get you talking about a couple things that you're working on right now and just a couple things that are going on in general up there. So we've had managed healthcare for just about 3 years, and I wanted to know how the system is doing and if you have any proposed solutions to the problems that have been ongoing.
Well, I currently serve on the Oversight Committee for our state Medicaid program when it comes to managed care. And we've been into it now for pretty close to 3 years. And we had a real rocky start, and things are getting better, but we're not where we should be today. And I've spoken with many providers and also recipients of Medicaid services, and we're still not meeting our goals, I believe, in providing quality health care to our over 600,000 people who are on our state Medicaid program.
So what is it that you're going to do or propose to do? Or?
Well, there's a bill out that I'm co-sponsoring with Representative Lisa Hedden in the House that would carve out a certain population in our state Medicaid program. Mm-hmm. And the populations that we're having the most issues with are our long-term care patients and our disability patients. It seems like the majority of the problems that we get called on are those types of patients who are being denied certain types of care where they've been on it for maybe years. And so we want to make sure that these patients receive the care that they need. And they're also probably our highest dollar cost per patient in the program. And so if we bring that back under the state care, I think we can do a better job of managing those patients and hopefully in the long run save costs, because the managed care organizations can charge the state up to a 12% administration fee.
Wow.
That's a lot of money.
It is a lot of money.
And when the state ran it, we ran that same program for about a 5% administration fee. So you do the math, and if we can carve out or bring some of those patients back into our system, I think we can give better care, and I think in the long run can save money for the state of Iowa.
Well, sounds like you got your work cut out for you.
Yeah, it's going to be, it's going to take a bipartisan effect to get that through.
And it should be, right?
It's exactly.
A managed state program. So.
Yeah, we want to do what's best for the patient.
Right.
And I think looking at this as an option, I think we should look at this very strongly.
Oh, very good. Let's talk about this year's upcoming budget. What are your thoughts about revenue and expenses for the upcoming fiscal year starting in July?
Well, this year's budget, I think, which ends at the end of this June 30th this year, I think we're going to be fine. My concern is going forward into our budget year 2020, where the Revenue Estimating Conference is, and their last numbers they gave us, which was last fall, was about a 1.7% growth in revenue for here in the state of Iowa. For the state to really stay even, we need to be at about 3%. And so my concern is we've got vital programs like education, our state Medicaid program, public safety, just to name a few that are going to need these dollars to fund. And if our revenue doesn't keep up with our spending, we're going to have to make some very, very tough decisions. Farm income is also suffering. As you know, commodity prices have not staying pace with production costs. Also the tariffs that have been implemented over the past few months on pork and soybeans has really hit hard up for farmers here in the state of Iowa. And I know I've spoken to a few that are very concerned about survivability in the next 2 to 3 years. So we need to continue to look at programs that, again, strengthen our farm economy here in the state of Iowa.
John, tell me what your proposed bill that would fund, and you can tell me the acronym for that, and mental health.
Well, I have a bill that's being drafted right now. It's not, I don't have it on my desk yet, but I'm hoping to have it this week, that would increase our state sales tax by 1 cent.
Okay.
Okay, so that's a 1 cent sales tax. That's a pretty big hit to a lot of people here in the state of Iowa. But the money, I think, will be used for things that the people in Iowa really are asking for. Number one is water quality, funding Iowa Water and Land Legacy, which passed in 2010 by over 63% of Iowans. People want to make sure we have clean water here in the state of Iowa. They also want to make sure that we continue to build on our park system here in the state. We've kind of let that go a little bit. So this bill would generate, the 3/8 cent would generate about maybe up to $180 million to put forward to water quality initiatives here in our state and make our state parks stronger. Secondly, the other 3/8 of the cent could be used for mental health services here in the state of Iowa. Iowa has kind of lagged behind when it comes to mental health, both in adult and children. So this other $180 million that could be possibly generated could be used then to provide quality services. On the other side of that, we now fund a lot of our mental health services through our property taxes we pay on our businesses and homes. That generates about $114 million a year. It's not enough money to really adequately provide the services that Iowans really need. So this bill would take that $180 million from the sales tax, that 3/8 of a cent, but on the other end, we would then eliminate that $114 million bill that people are paying on their property taxes each and every year. And I think that's been a kind of a sticking point at the Capitol. Farm Bureau has really been holding strong on not changing that formula. And within Polk County, we've seen some very, very, I would say, shortfalls in funding for mental health services for people here in the Polk County area. And I think this plan would be a more fairer plan for not only the larger cities, but the smaller cities throughout the state of Iowa. The third part, the 2/8 cent, now that's what we're kind of discussing right now, but we could, when you raise sales tax, it's a regressive tax. So it has a negative impact on lower income Iowans. So we could look at maybe doing some earned income tax credits for people in the lower income levels that would be paying more when they go into stores to purchase products, but then we can make it up with an earned income tax credit when they pay their taxes at the end of the year.
I mean, that's an interesting concept to make that work, right?
Yeah, I mean, people don't like to raise taxes, but when I was out campaigning over the last fall, the two things that people really talked to me about were clean water and making sure we provide adequate mental health care services here in the state of Iowa.
Which brings up a follow-up question. In your opinion, do you think our water is clean as it sits right now, or do we have a ways to go? We have
a ways to go. We still have a lot of runoff into the streams and even lakes here in the state of Iowa. Iowa is kind of lagged behind the other states that surround us, like Minnesota, Wisconsin, and even into Illinois. And all that nitrate is moving into the Mississippi River Basin, and all that nitrate then finally ends up in the Gulf of Mexico. And we've got these dead zones down there where the fishing industry is being impacted heavily down there too. So, no, we need to do a better job. We don't put enough money into our water quality programs. They say it's about a $4 billion fix. Now, we're not going to do that overnight.
No.
It's a 20-year program, and by this money being funded towards those, I think we can get it done, but it's going to take quite a few years to really fix the problem.
Seems like our mental health has lagged behind too, and not quite sure why our mental health is so much further behind other states.
Well, part of the problem is when this levy was put in place in 1996, there was a cap put on it. And that cap was $114 million that could be levied under property taxes through the state. The state of Iowa's population has grown quite a bit since 1996. In fact, just here in Polk County, we've all seen about 100,000 more people living in the Polk County area than was in 1996. So we've not kept up with the needs of people in the funding areas for mental health.
What is the discussion down at the legislature concerning the medical cannabis, and what are they, or if any, bills will help enhance that program?
Well, we did pass a medical cannabis bill in 2014, and we did a lot of modification in 2016, and now we've got medical cannabis available right now to people here in the state of Iowa. The issue is now is two things: expansion of medical conditions covered under medical cannabis, and number two, taking the cap or modifying the amount of THC that can be in the product. And so I'll be working with my Democrat and Republican legislators to try to fix those two problems. Give better access to more patients for medical cannabis. As I've said in the past, I'm a pharmacist, and I really believe that when a patient goes to their physician, medical cannabis is not first-line therapy. They try their conventional medications. If those don't work, they can supplement with medical cannabis. And in some cases, they've seen people who are on the opioids, pain medications, have seen a 50% reduction in the amount of opioids they're taking if they use medical cannabis. So we're hopeful to get something done this session.
Yeah, well, it's good that you, since you're on that committee, that you're a pharmacist, because I think you probably understand, a lot more on the medical side,
Yeah.
So.
And I've worked with Senator Brad Zahn, my senator from Urbandale. We've worked on this for the past 4 or 5 years. I know he has a great bill over in the Senate, and so I'm hopeful we can get that over in the House and get it debated.
Good to hear, yeah. What are your thoughts about the criminal justice reform? I know that's kind of a hot button right now this year. So.
We're going to be probably taking up a bill. I know the governor, that's one of her top priorities, I think, in her State of the State address she gave us 2 or 3 weeks ago. I think that we need to relook at criminal sentencing for nonviolent crimes. We're probably putting too many people, or not the right people, in prison for too long periods of time. So I think that we'll be seeing legislation coming forward that will hopefully address that. And the violent crimes, of course, we're going to keep those people locked up. But some of the other crimes that maybe have to do with some drug issues, I think we're going to take another look at those and maybe try to get them more fair or in line with the
kind
sentencing.
of a little bit of a second chance.
More or less, yeah. I'd rather have these people tax-paying citizens
Absolutely.
than sitting in prisons here in the
Productive
state of
members
Iowa.
of society, as long as they're not violent.
As long as they're not violent, yes.
Finally, what are your thoughts about the education funding this year? That seems to always be a discussion item.
We've always over the past few years we've I think underfunded K through 12 all the way through community colleges and our state regents universities. I was optimistic when the governor came out with her recommendation of a 2.3% increase in school aid formula, SSA, I believe they refer to it as. That's a good start, but we're still not keeping up with education funding here in our state. We need about 3% increase in growth and funding to be able to adequately provide for children in the state to make sure they get a quality education.
Very good. Well, that's it for this morning. Representative Forbes, we appreciate you coming in. It was a great conversation. Sounds like you're a busy man and are tackling some pretty major projects. So we appreciate you coming and spending time with us. Thanks again for tuning in to Capitol Preview, and join us on another episode.